Now our GMA cover story, a potential new use for mammograms. Doctors at Northwell Health in New York are now using them to identify women at risk. Are you ready for this? For heart disease. Our chief medical correspondent, Dr. Narula, a cardiologist, joins us now with more. Good morning.
Good morning, Robin. What if there was a clue to a woman's risk of heart disease visible in her mammogram? It's certainly information that can be life-changing. Well, that's exactly what happened to one woman when she got her mammogram report last year. Take a look. Catherine's mammogram results included something new. Doctors said there were no signs of breast cancer, but her mammogram showed breast arterial calcification, or BAC.
I would have never thought to go to a cardiologist because I always felt healthy.
Research shows 12 to 23% of mammograms have tiny calcifications in the breast arteries, which are associated with an increased risk of heart disease and stroke.
Every radiologist sees breast arterial calcification. It's very obvious. But there are no guidelines about including it in your report. The mammogram report doesn't have to include whether you have signs of heart disease.
But doctors at Northwell's Katz Institute for Women's Health are trying to change that. Their new initiative now requires every mammogram to report signs of BAC. And if a woman has breast arterial calcification, she is advised to speak to her doctor about her risk for heart disease.
A lot of those women were finding out for the first time that they might be at risk for heart disease just by having a mammogram.
If you have that finding, we would work with our patients to modify risk factors, lower blood pressure, lower cholesterol, and those things prevent heart disease, stroke, and also cancer.
Cardiovascular disease is the leading cause of death for women. Early screening and learning about risk factors can be life-changing for women like Catherine. After her mammogram results showed BAC, she was sent to a cardiologist and discovered one of her heart arteries was severely blocked. She then had a stent placed in her heart artery to improve blood flow to her heart.
If they didn't look for it in me, who knows if I'd be sitting here now. Mammogram saved my life.
Dr. Vinkoff told us that to find BAC and include it in the report only takes a matter of seconds, so it would not be a big change to the current mammogram process.
Okay,
Robin.
You have our attention right now.
Good.
Oh my goodness. So what is the hope, the team, the Katz team, what are they hoping with this work?
Well, Robin, they believe this is really low-hanging fruit and this is potentially game-changing, and I'll tell you why. We've known about BAC, this risk with heart disease, for decades. We know that cardiovascular disease, as you heard, is the leading cause of death for women, and we don't have great screening tools, particularly for young women, and many times the first sign is when you have a heart attack or stroke. This does not add cost or time or radiation, and when they've done research and surveyed women who've gotten these results in their report, they've universally, a majority have said, I want this information. So the question, Robin, is why? Why is this not the standard of care? And that is what the Katz team is hoping to do, to really move the needle so that nationally it does become universally reported. They're also going to look at this database of women. They now have 15,000 women that they have seen BAC in, and they're going to follow them to see what happens to these women. Do they get further testing? Do they have heart attacks? Do they get put on medication? Do they see cardiologists? All of that data, that robust data, will again help in terms of moving us forward.
And it is robust data.
It is.
I mean, so much of this. All right. A woman that's watching right now, what should she be asking her doctor or radiologist?
Well, we know until this becomes standard, women are going to have to advocate for themselves. They can certainly look for institutions that do BAC reporting as the standard. Many other places will do it for a fee or a charge, but you should ask up front. And then if you've had your mammogram read, go back to your gynecologist or whoever ordered it, or the radiologist, and ask, did they see breast arterial calcification? It's important, Robin, to also say that if you have BAC, it does not mean you have heart disease. If you don't have BAC, it doesn't mean also that you're clear. But all of this means sit down with a cardiologist or your doctor. If you do have breast arterial calcification, talk about any symptoms, risk factors, possible screening tests that you may want to do. I mean, this is so, so important. 2 for 1, a test that could potentially help with breast cancer and heart disease, the leading cause of death. We can't say that enough.
We cannot say that enough. Dr. Narula, thank you so much. Thank you. Appreciate that.